In today's video, we're going over special tests for femoral acetabular impingement syndrome and hip labral pathology. So femoral acetabular impingement syndrome is a diagnosis that's often missed by healthcare providers. It's often diagnosed as a hip flexor strain. So I want to make sure we have both sensitive and specific tests to help us either rule out or rule in FAI. My name is Dan Pope. I'm a cash-based physical therapist, personal trainer, and coach. I love all things strength and fitness. At Fitness Pain Free, we're trying to level up your game as a coach and clinician. So patients with FAI will typically say they have some pain in the front portion of the hip, right here, or pain that kind of extends into the groin. Sometimes we'll talk about a C sign. So essentially, if I take the web space in my hand, the patient says, I have pain kind of right in this area here. That kind of helps you start thinking, all right, maybe this hip is involved, right? The other piece is that folks with FAI often have trouble with combination of hip flexion and rotation, and oftentimes it hurts to sit. So a classic thing that patients tell me is that when I try to drive, my hip just kills me. So first, let's talk about some sensitive tests. So sensitive tests are good for ruling out the condition. So essentially, if I do these tests and they're negative, I'm fairly confident that the patient does not have something like FAI, and maybe I start to think maybe this is looking more like a hip flexor strain or something else of the sort. First test, a very sensitive test, is the anterior impingement test. So I'm going to take the patient's leg, flex up to 90 degrees here, go to end range internal rotation, and then horizontally adduct. If this reproduces the patient's familiar symptoms right in the front of the hip, that would be a positive test. A quick note about these tests, for some folks when they're coming in after you have some sort of suspected FAI, if you crank these tests, it can really irritate them. So you don't have to go to end range if the patient is already reporting symptoms once you start that. The next sensitive test is going to be a failure test. So essentially, you're taking the patient into flexion, adduction, and internal rotation in one movement. So I take the leg up, flex, internally rotate, adduct. A positive test is reproduction of symptoms in the front/inside of the joint, right? And then it should reproduce the patient's familiar symptoms. This is often a little bit irritating for most folks, so you want to make sure that's actually the pain they're experiencing, what they're coming in to see you for, as opposed to just it feels a little tight in the front of the hip. So next we want to try to have some specific tests to help to rule in FAI. So if I just did the failure as well as the anterior impingement and they're both positive, they don't tell me a lot about whether or not the patient actually has FAI, just because they are sensitive tests and they're not specific tests. So if they're negative, then I can be fairly confident the patient doesn't have FAI, but if they're positive, it doesn't give me confidence the patient actually has FAI, right? So specific tests do that. So the test we're going to use is a prone hip internal rotation test. So I'll have you flop over onto your stomach here. Very good. Next, we'll bring your knees together. Yep. And then from here, bend the knees to 90 degrees. And I want you to maximally internally rotate on both sides, so just spread apart your feet as much as possible. So a positive special test would be a reproduction of pain or limitation on the side that's symptomatic. Any pain with this? Okay, hip labral tear. So if you guys are interested in the sensitivities and specificities and the research article that we were just talking about, you can just take a look here, right? And if you're enjoying this video and you want to learn more, I have another video for you. It's up here. There you go. So click on that link and keep learning.